Tashidelek, Namaste, and Vannakam to all. Unkalai mintam parpatu nallatu, which means good to see you again. I'm, I'm honored to be hosting this event in the gracious presence of our Honorable Director, Mr. Tashi Sring Pupila, and our distinguished experts, Dr. Tirunarayanan ji from Siddha Medicine, Dr. Nagendra Babuji from Homeopathy Medicine, Dr. Dojer Abdullah from SOAR Tibetan Medicine, Chief Astroscience Practitioner Tsering Chenzumla from Tibetan Astroscience, and our dear participants from different parts of the world. So to begin with, firstly, I would like to request our director to kindly deliver the opening address.
Hello. Hello, I'm very happy that our Bangalore Men-Tsee-Khang Mental Health Department is able to organize another webinar on mental health. This is the 12th webinar. Can you hear?
Oh, good.
Oh, yes. This is the third webinar session we had, of which 3 were on mental health. So that shows how importance we attach on this mental health issues. Tibetan Buddhism, Tibetan medical science, and Tibetan astroscience is profound and very rich in the contribution or the knowledge in mental health. But then the practice or the action we take have been limited. So during the last few years or so, we have been paying much attention on the mental health issues. In fact, we had seminars on body, mind, and life conferences, which is also part of the mental health. And so in the mental health, we will be having more of such seminars, and I'm happy that our staff, those sort of understaffed department, we can say, new department, are very active and doing well in terms of organizing such seminars, and then also the publications like that. So I'm very happy. A few years ago, 46 doctors from France, they were here to learn Tibetan medicine, and over a period of six days. And during an audience with His Holiness, the President asked His Holiness what in Tibetan medicine should they need to concentrate. And His Holiness immediately responded that the Tibetan medicine to heal mental disorders, that if you take some caution, that will be very good. So later they invited a senior doctor from Men-Tsee-Khang. They were in France for dialoguing, and we had plan was to have more such seminar anyway. So our, and not only the medicine, even our astroscience has lot to contribute in this mental health. So I'm happy to participate in this third sort of seminar from the mental health department. And today we have senior astroscience practitioner. She is the chief and also the head of the astroscience department, Mrs. Tsering Chenzum. Then Dr. Tirunarayanan, and we met several times in different seminars. And then our chief medical officer of our Bangalore branch, Dr. Dojer Abdullah, and then Dr. Nagendra. So 4 of the eminent speakers will be making their presentations, and I'm happy to participate till the end. And then today we have some participants, so even from Bhutan and Nepal. and Nepal. And after their session, there'll be ample time for question and answer, sort of dialoguing like that. So I request the department head to proceed with her sort of plans. Thank you very much.
Thank you, sir. So now, as we begin with our case presentation sessions, I request my colleague, our department translator, Mr. Tenzin, to give a brief introduction of our first speaker, who will speak on mental health and pandemic.
Thank you so much. Trustalik, and very good afternoon to all. Let me briefly introduce today's first speaker. Chief Astro Science Practitioner, Mrs. Sring Chonzumla, is the first Tibetan woman astroscience practitioner and currently the head of Astroscience Department. She is also the vice chairman of the Medical and Astro Council of Men-Tsee-Khang. She has served as lecturer at TMA College and continues to guide the aspiring Tibetan astroscience practitioner. And she officially traveled worldwide promoting Tibetan astroscience through lectures and oral consultations. Thank you.
I request our first speaker to kindly start with your presentation. Thank you.
Good afternoon and good health wishes to our director, organizer, mental health department, speakers and participants.
Good afternoon.
I have no case history related to the topic pandemic and mental health to be shared with you today, but I'm going to share information and facts that we have experienced during this pandemic. In our life, we have ups and downs, and during the difficult times, we are more challenged physically, mentally, and emotionally. So, pandemic, in a way, is a difficult time. As we are aware, in a life of a person, there are times when we are elated, happy, and content. And then we have times when we feel like giving up and things get difficult. Just like this, in the life of our world, in the life of this planet, coming of pandemic is a test. Test, in a way, it brings a lot of setbacks, difficulties, and tyranny. In our understanding, as per Tibetan astroscience, most of the difficulties in life happens or takes place when we are ruled by a more malefic planet, be it Saturn, be it Ketu, Mars, etc. So in that aspect, we may not, though from a general eye or general person's perspective, we may not identify it. But when we go deeper into the calculations and Tibetan astroscience, we get the understanding that it has been influenced by the effect of the malefic planets and their position in our yearly almanac or yearly chart. This is where we feel we can decode and where we can offer help to pacify and make things better. In our Tibetan astrology, and particularly the horoscope, we give good importance and we highlight and we give more importance to the mental well-being, because especially at this time, not only the physical wellness, but also the mental wellness is even more important considering the conditions we are in and challenges of the day-to-day life. So, taking a small example, like in our work, there are days when we feel like we are able to do things, energies are getting transmitted into more productivity, and there are times we feel like things are not going so well, and setbacks and so forth. These are all realities of life, and we have to accept it. But when things are not happening so favorably, and undesired situations continue for long, then we need to seek help, because shouldering it for long will not help. So it is more like an alarm to your life. The person with the bad planetary positions in the zodiacal houses at one's time of birth has greater danger to face more challenges in life. From the division of estimated lifespan under 9 ruling planets to the planet that is wrathful in nature, and especially when it coincides with the obstacle year, whose year sign equal to the calendar year, which is the age 1, 13, 25, 37, 49, 61, etc. And then Dunsu, whose year sign falls on 7th from the current calendar year sign. Shishe, whose year sign falls on 4th from the current calendar year sign, and so forth, will have more impact on the well-being of the individual, and there the danger of losing out to a pandemic will be more, since sensitivity and low in energy level support these to happen. More than ever, mental health needs to be highlighted, not just while suffering the COVID, but also in the post-COVID. Things continue to damage us in many ways. As you all are aware, during the suffering of COVID itself, the duration of impact of the disease very much depends on your immune system, mental health, and so forth, as it disturbs both the physical and mental aspect of our life, our health, I mean. Then even after recovering from the COVID, difficulties still remain, and in many cases, they still needed the physical support, mental support, and emotional support. And even to those who have not suffered COVID, being a family member of someone who have suffered, and also in the times like this, where things are very uncertain, even when we have not suffered COVID, there is certain fear, stress, that we couldn't eat or sleep properly. As we find from the scientific findings, that constant coming of these fear and stress even reduces the functioning of immune system, and so forth. So during all these pre-COVID times, I mean, before you suffer the COVID, and then during the COVID itself, and also post-COVID, everything takes a toll upon your own mental health. In a way, when we talk about the topic pandemic and mental health, we find that these two are very much related. It is more like double stress. Mental health is already disturbed or challenged constantly in the present context of life because of the challenges that we are in, be it in our society, community, and the demands of life. And adding to it, there is this pandemic that challenges not just one community or country, but the entire world. Coming of this is a message that mental health cannot be ignored and needs special attention. In that aspect, we have gathered here with different medical traditions as, like many of you, I believe that holistic understanding or holistic contribution to any issue is better, be it in the understanding of the problem, bettering our preparation, bettering our prevention, and so forth. So, from the Tibetan astroscience aspect, it is much depends upon the Buddhist philosophy. After having understood the issue with the astrological calculations, the antidotes and treatment, starting with taking care of your mindset and chanting of prayers and meditation, then spiritual offerings and pujas not only helps for the moment, but also helps for the long run to stabilize the situation. Moreover, there are different kinds of amulets that safeguards in the difficult time, both physically and mentally. It is highly recommendable to stay positive, focus, and do the needful without doubting about it. Mental health is something at this point of time to be paid more attention, as everything can be better or worse with this. I, of course, in my past 33 plus years of service in the field of Tibetan astroscience, I have for a number of times got opportunity to serve people with mental problems, mental health issues relating to family problems, relationship issues, failure in aspirations, severe health cases, etc., and got highly benefited by the service offered. And thank you.
Thank you, ma'am. So when we speak of mental health, we cannot deny the role of planets and other influences. So thank you for enlightening us on the preventive measures from the Tibetan astroscience perspective. Thank you very much. So, so regarding our next three speakers, firstly, I would like to say that indeed, it is indeed a matter of great pride for all of us that the Ayush systems of medicine have proven very beneficial in boosting both the physical and mental immunity in this pandemic, and specifically in the treatment of COVID cases. So, as requested, our speakers will share their COVID case studies from their field of medicines, highlighting how COVID impacted mental health and how their respective medical system has contributed in the treatment of the same. So, I request my colleague, Mr. Men-Tsee-Khang, to give a brief introduction of the second speaker.
Good afternoon once again. Dr. Thirunarayanan Ji is the Secretary of Center for Traditional Medicine and Research, CTMR, and NGO. He is also the principal investigator in documenting traditional health practice in different districts of Tamil Nadu. During the courses of his career, he has been invited to deliver lectures in various universities and institutions in India and abroad. He regularly conducts lifestyle training program for healthy living through Siddha in Malaysia, Russia, US, and other countries. He has done many health awareness shows on ISM to Arogya Bratham health program of Doordarshan sponsored by Ministry of Health, promoting awareness through mass media for healthy living. Thank you so much. I would like to request Dr. Thirunarayanan Ji to kindly start with your presentation.
Thank you. Somebody is sharing the slides or I should share the slides? Am I audible?
Yes. Doji will share your presentation. Doji will share your slide.
Okay, sure.
So Dr. Thiru's presentation slide will be available on our page.
No, now, during the presentation. Okay, let me start. Vanakkam from Chennai. When the COVID onset was done in January 2020, when the first case was reported in India from Kerala, it was an unknown monster. No one of us were clear about what will be the clinical features, what will be the manifestation, post-infection, and how does it spread. We had no idea, and we had no specific treatment guidelines. So this has led to a fear and panic, not only among the common man, the medical community, and the health administrators. What we saw from China on the TV scared us more. So we had no idea how to prevent, what to do. Hospitalization, availability of bed, oxygen, medicines. Everything was a question. So this has led to the situation where there was fear, worry, concern in the population at large and the specific group. Like we were told that the elderly will be more affected. And the problem with the elderly in the city limits of Chennai is many of them stay alone here while the children are abroad. So the care providers, even the doctors are scared. People with underlying health conditions, comorbidity, they were scared. So the main psychological impact is elevated rates of stress and anxiety. Then came the time of quarantine, the lockdown. When it came, it impacted many people's daily activity, the routine, their livelihoods. So what happened was loneliness, depression, and some took to the harmful alcohol or drug abuse. In fact, some of them went to the extreme of self-harm or suicidal behavior. There were few suicides also in Tamil Nadu. So how do we respond to that? I'm talking as a Siddha physician. The response from my personal point of view, how do we respond? Right. The first thing we did was learned and read as many research papers on coronavirus. We realized this COVID-19 was not something new, excepting the way in which it spread, the way in which it affected people. The corona type of virus, that shape, the size, were pre-existing as SARS, South Asian Respiratory Syndrome virus, and the Middle East Respiratory Syndrome virus in 2002 and 2012. Then, considering the shape of the virus, we decided look through into Siddha literature. We had plenty of herbs which were used in viral diseases like the jaundice, viral hepatitis, like HIV, herpes simplex, various conditions, and even common cold, which is a viral condition. So when we started exploring all the possibilities of various herbs, we came to a conclusion. Particular herbs like Bonimba or Yashimadu. I'm using the Sanskrit word so that everyone can understand. So we realized there are few herbs used in Siddha which have an antiviral property even against a specific corona type of virus. Then molecular docking studies were initiated. This molecular docking studies means the structure of the virus combined with the structure of the chemical compound present in the herb. So we came to a conclusion that our choice of herbs were perfect. So we decided whether we have a guidelines issued by Ministry of Ayush or otherwise, we will start community-based intervention in the vulnerable groups. What did we do as a public intervention? First thing that we did was, personally me, took to the visual media, appeared in most of the Tamil channels, talked about how to fight the virus, what is immunity, what will give you immunity on a long term, not just a immunity or a antibody development towards a particular virus, but your ability of the body to fight against any invading organism. Healthy food, enough exercise, good sleep, maintaining the routine. In spite of situation, you have to maintain your routine. Practice pranayama and of course take some specific Siddha kashayas. Kashayas are nothing but decoctions. At specific intervals at right dose and right duration. So these are the interventions. We did this intervention in the community, in the vulnerable group, in the industrial setup, in an ashram where people were staying and learning Vedanta. So in different group of people, right in the month of March 2020, when the first case was reported in Tamil Nadu, we started this intervention. Once the cases started coming, that was the time when the government of India released a treatment guidelines and allowed Siddha practitioners to treat COVID patients. But the condition was we need to treat only the mild patients. But when we realized patients came only when they developed symptoms, because there was so much of fear among the society that they will be isolated, they will be quarantined. In fact, that was the case study I am going to present a little later. We initiated teleconsultation, started counseling to dispel the fear and panic. These are the two mental issues that came. We told them that these methodologies that we have mentioned earlier, like the food, exercise, sleep, the Siddha kashayams, can destroy the virus and prevent the disease. We counseled them and we educated them how to safeguard the other family members and themselves. The most important advice that we gave was to stay away from misinformation in social media and reduce news reading and watching time. Then we decided to conduct training programs. We chose the community leaders, the industry managers, the colleges and schools which are opinion makers, the vulnerable groups of elders staying in, old age homes or I don't want to use the name, but still the nursing homes we call it in the West, right? The media houses. More important, the media needs to be educated. So we did a series of webinars and social media group lectures, and we did a lot of lectures in colleges through online. The main objective is to allay fear, stay connected with the individual, because the feeling of loneliness created problem of depression subsequently. But when they realized that there is somebody to talk to, somebody who will give them support, somebody will guide them on various things, then their stress levels came down. So this also helped prevent the panic. The medical intervention that we did, these are the non-pharmacological interventions, now the medical interventions. What we did was, we chose two varieties of kashayams. gave to people for 3 days continuously, twice a day, and documented all their Aadhaar numbers and other numbers who the beneficiaries. This we repeated every month till now in a group of 1,000 people. And for all these 1,000 people, test RT-PCR, that test for COVID positivity, was carried out at the interval of 2 months from August last year. And of the 1,000 persons who were given this quagga, only 3 people got infected. Right? This ensured the same was the experience in the ashram and other patient groups also. Then coming to treatment of the patients. Government allowed us to treat patients in the home quarantine, but we ensured that every 4 hours they send us the WhatsApp message on the oxygen saturation, temperature, respiratory rate, pulse rate, twice a day monitoring of BP in people who are hypertensive, and every 3rd day measurement of diabetic, blood sugar levels in diabetic. This constant follow-up allied the fear. In fact, they have small doubts also of what to eat, what not to eat, and all those things. We were continuously counseling them. We had a standard template, and also we used specific messages for specific queries. The social trauma, this is what I want to highlight. See, in the beginning, people who got infected in the March, April, even the neighbors were staying away. They were finding it very difficult to get, in Tamil Nadu, the houses were sealed. Anybody infected, the infected person was taken to a COVID care center or a hospital. Rest of the family members were staying indoors, but the doors were sealed by tin sheets. So they were not getting a proper help or assistance. The elderly are left alone in case where children were living abroad and could not come due to travel restriction. These are the social trauma that we need to address. Fortunately, Government of Tamil Nadu opened 50 Siddha COVID care centers across the state, which provided stay in quarantine, nourishing food, group activity, and kashayams. So this place where people sit together, had a food and Siddha medications, they had a lot of relief. I would say the counseling, the monitoring helped them a lot than the medicines themselves. And what kind of therapy was recommended? Sun exposure, deep breathing exercise, that is pranayama, postures, asana, and once they are recovered, to understand whether they are recovering, their lung damage is not high, whether they are able to do the routine activity, we encourage them to start static jogging, skipping for a limited time period. Right? Then we kept them alert with music, games, and quiz. Even we encourage people who are in quarantine during the lockdown to have a group of people, friends or family, and conduct quiz programs, group activities like online music and things like games, online games. This was encouraged to a large extent, and that helped the people a lot. Mind you, this is without exerting too much, because any exertion of dancing and things like that would have definitely caused a sudden cardiac hypoxia death, and that we did not try to do that on. Now the challenge is the post-COVID care. Migraine and headache, loss of appetite, myalgia, altered blood sugar levels, high BP, loss of appetite, loss of sleep. Up to 3 months, all the patients whom are treated in the second wave, some 870 patients, and only 3 required hospitalization. Right? But many people who are not taking Siddha treatment but taking the biomedicine approach for post-COVID care, they also came to us. They are still coming to us, and at least my experience is 2 to 3 months they are scared, they are anxious, they don't get proper sleep, they don't get appetite, and some of them have lost their family members. That aggravates the problem more. So proper counseling, a simple, safe medication, a proper dietary advice, exercises, yoga, pranayama have helped many people. I have seen most people recovering in a month's time to 3 months. And even people who had 40% of lung involvement, 50% of lung involvement, who have resolving pneumonitis even today, they are comfortable taking these medicines for the body and the mind. And the therapy also included something very important. The therapy also included supplements like turmeric, long pepper, ashwagandha, amla, and jalbrahmi. Jalbrahmi and ashwagandha is an antiseptic. Jalbrahmi is for the sleep. Amla is for the bioavailability and for reducing the sugar with turmeric, and the long pepper for the bioavailability. So all this combination, the migraine was handled with the de-stressing with jalbrahmi, ashwagandha, and dry ginger sunti. So this kind of combination, not too many formulated drugs, simple herbal drugs and simple formulations have kept them active. So this is how we manage the trauma of the individuals was too much, and the group activity and counseling, the yoga, pranayama, the Ashtanga yoga of Saint Tirumala is something which helped them a lot. Thank you very much. I know there will be some questions. We will answer it after all presentations. Thank you.
Thank you, Dr. Tirunarayananji, for sharing your Siddha COVID care experience with us. Thank you so much. So for next, we have Dr. Doji Rabdinla, and I would like to request Kandila to kindly give a brief introduction.
Good afternoon. Dr. Doji Rabdinla is one of the senior most doctors of Men-Tsee-Khang. He has more than 30 years of experience in the field of Soaripa. His clinical research studies on cancer in TM, Tibetan medicine, are very well known. He has attended many national and international conferences, presented many papers on Tibetan medicines, and has a number of published articles to his credit. He is a recipient of various awards. He was the chairman of Central Council of Tibetan Medicine from 2007 to 2009. Currently, Dr. Dojila is working as the chief physician at Tibetan Medicine Center, Bangalore-based branch clinic of Tibetan Medical Institution, Dharamsala. Thank you so much. I would like to request Dr. Doji Rabdinla to kindly start with your presentation, sir, please.
So good evening, everybody. Tashi Dele, especially to our very old friend, Dr. Thiru. Dr. Thiru, Dr. Nagendra Babu, thank you so much for the participating in this webinar. Dr. Thiru looks very young. I don't know, because of some very special Siddha recipe. This year, as we all know, 2020, 2021, I think is a year of COVID, and it's something what we call it, very astrologically also, maybe very bad year, cosmologically also maybe very negative year, and something like where we, probably in Tibetan medical system, we believe that, our universe, sometimes undergoes some, kind of serious changes like this. So probably 2020-21 is a year of this kind of severe kind of, the global changes. Anyway, the pandemic actually has started from 2019, way back 2019 November, early November, December, and then probably starting with some kind of few thousand cases, and slowly 2020, 21. Now, more than kind of I don't know how many millions, millions people almost like die. The kind of the fatality rates of so bad, so strong, and more than, I would say, half of the humanity had undergone a kind of strict lockdown. There was innumerable kind of innumerable difficulties, innumerable sufferings, unknown, and kind of the globally there was something which something nobody has actually predicted, but we underwent such kind of suffering, a kind of year of hopelessness, a year of helplessness, a year of kind of severe kind of anxiety, year of panic, anger, aggression. There was a lot of anger also, because of the much of the anger was also because these viruses come from China. And people were, I mean, not only the Tibetans, but all over the world, the anger is really evident, But I personally think that we, instead of really going ahead with people are running after the vaccination, people are running after the treatment, people are running after so many things which actually are more temporarily. They are they may be helpful temporarily, but more than anything else, probably this should open the kind of our own eye, that this is just a kind of probably a kind of what do you call it, show of some kind of worse things to come. We have seen epidemics, pandemics since the since prehistoric region, and we have a lot of people have millions of lives have been lost because of epidemics and pandemics. I don't have to tell, but still we have never learned the lesson. We have never learned the lesson. We are only after probably some kind of shortcut or temporary vaccination, probably pumping a lot of money for the vaccinations and and then treatments and but then I think traditionally especially the traditional herbal kind of or traditional systems of medicines like Ayurveda, Tibetan medicine, Siddha, I think they have a lot of things to offer. Not only in terms of the prophylactic measures like preventive measures, but mainly how to understand the epidemic, the nature of this epidemic, the nature of this suffering. So how do we really end this, which is very important. But this is a big subject. I will not go into this detail, but it's, for me, it's much, especially from the discipline of the traditional systems of medicine. We need to come together, and then make up this very strong point that more than just the giving importance to the temporary kind of solutions, like we need to focus more, understand more the nature of the suffering. According to the Tibetan systems of medicine, that these epidemics, pandemics, in the form of a kind of curse from the mother nature, because our mother nature is suffering. We as a human being has been really very kind of brutal, immoral, kind of what do you call it? With a lot of kind of death and destructions of our environment, our mother nature. In Tibetan medicine, there was a clear mention that there will be a time, especially eons after eons. Now 500 eons later, and especially the period of degenerating era, there will be a time where people would engage in such kind of immoral activities, and then our moral values and the destruction, especially of the mother nature, will be in such that all the forces of the mother nature, in turn will bring upon this earth as a curse of so many dreadful, such kind of dreadful, infectious diseases, including, such kind of pandemics. Now, so question is actually, we need to probably know how to make amendments, how to appease our mother nature, how to bring back that kind of very delicate balance, that kind of dynamic balance between our body system, that is called, we call it in a microcosmic body, and the macrocosmic body, that is our universe, our environment. We need to bring back that delicate balance, that very important kind of, the relationship, which has gone totally wrong now. So therefore, such kind of, the what do you call it, the natural destructions, of all the five cosmophysical elements, that actually makes up our mother nature and our body system also, and you can see all these kind of calamities, all the sufferings are in the form of five cosmophysical elements, in the form of the landslide, the earth, water, fire, air, and space, the landslides we see, the floods we see, now the raging bushfires that we see, and all the kind of the atmospheric pollutions, the kind of all these forms the kind of death and destruction, calamities, because of the five cosmophysical elements. And since this is the curse of the mother nature, because of that, the nature of this kind of infection may have a severe toll on our own mind, because they are also what we Tibetans call a kind of some supramundane kind of spirits. These spirits, when they bring forth the kind of destructions, they are naturally in a kind of bit, vengeance, a kind of what do you call it, agitation. You will see the agitation in the form of the vengeance. So therefore, the very nature of this kind of the pandemics can also bring a lot of mental agitations, fear, aggression, and agitations. That's quite natural. It was also very clearly mentioned in the medical text. This is not something very new. And on top of that, the kind of what do we call it, scenario, the global scenario, the fear scenario, that we have made, everybody has contributed, the governments and non-NGOs, and especially the what do you call it, what is it, news channels, the way they bring out the news, and such that it can really build up so many kind of uncertainties and fear in the mind of the people. We have noticed that most of the deaths which are related to the COVID are actually not from the kind of the pathological condition of the virus itself, but move from the fear and the panic they are associated with that. So therefore, these fear and kind of panic are actually largely because of our own kind of actions, our own actions. We have painted up such a gross kind of negative picture as Dr. Thiru said, a monster-like picture of this pandemic. Monster-like picture. That as though there is no escape from this. So therefore, the people naturally, that fear, agony, the kind of hopelessness, the kind of helplessness, now when there is a, somebody is affected, the first thing they know whether there is, hospital beds available or not. If the beds are available, then oxygen, then kind of the ventilation, the available or not. So many fear. And you could also see a kind of pictures of the, pictures of so many gory deaths and burning of the, dead bodies. And I think, we ourselves have painted a so negative picture of this. So therefore, naturally, now having said that, how do we really counteract this? In the Tibetan medical, text, it was also clearly mentioned that, and nature of the, infection, the nature of the kind of, the disease, the epidemic itself brings fear. There's no doubt about that. No doubt about that. Therefore, the people who are more kind of what you call scared, and they're very low, mentally very low, and dejected, depressed. They are the people who are mostly affected by the pandemic. On the contrary, you could see the people who are more positive, more cheerful, more determined, they are the least affected kind of people. So therefore, we need to understand the mental factor here, because I'm pretty sure and was, observing whole this scenario and really, come to some kind of conclusion that the disease actually has, the fear factor, the mental factor has killed more people than the disease per se. So now, when we deal with mental factor, we need to follow at least two aspects. Number one, mental factor, and the more kind of, in the, kind of family, the community, our society, and the mental factor of the kind of individuals who really have suffered a lot, innumerable sufferings. There's some of the family, I think maybe, I don't have to tell you that there was total kind of, destructions in the families. Therefore, but anyway, most important thing is that, we need to make sure that, as a doctor, as a health support, health practitioner, bring back some kind of reasonable kind of advice, the counseling to our people, to the suffering family members, to our society, that to allay, to kind of dispel that negative kind of monstrous kind of picture built up by our society. That yes, there is a light at the end of the channel. So it can be, when we say when the disease is there, cure is also there. So therefore, the kind of encouragement, may be very, very important, and need to look at the kind of also the nature of the, I think the nature of the kind of mental kind of health issues. We could also see a totally different picture. Some of the people, as I told earlier, have a lot of agitation in their mind. A lot of agitation, a lot of anger, hatred in their mind. And that this mental conditioning, that this mental emotion is something which needs to be dealt separately. And on the other hand, we also see a large section of the people who are not that agitated, but who quite opposite though, they go into some kind of depression, kind of as though.
Amchila, sorry to interrupt you. Now you have 5 minutes.
Okay, let me
He
finish up.
slept.
Okay. But anyway, in a nutshell, we need to see this. And by, because of this positive, I wouldn't say positive, yes, more agitated kind of emotions and more suppressive emotions. And we need to deal with these two emotions through the mental kind of, the perspective quite differently also. And most of the, sufferings, of course, most of the suffering, and particularly related to this pandemic, our own making. We say our own kind of, the emotions, which always comes into play, the our psychological, and that hits, we say that hits, I mean, very, very delicately, as well as very subtly to our nervous systems. And nervous systems in turn, and then, have a similar changes in the immunological functions. Therefore, we have understood that our fear is also related to, our immunological parameters. More kind of positive, more kind of determined, more, kind of, what do you call it, mentally positiveness, you have more immunological kind of strength. On the other hand, when you're more negative, when you go into some kind of depression, then again you have, immunity can go definitely low. We have, I'll give you two instances. There was one Tibetan student, I would say, in our Bangalore hostel, we have 30, 40, positive cases, almost 3 to 4 months back. One student, who had a very difficult time, and he called me several times in the night also. He was under some very strong kind of agitation in the mind. He was saying that he might not live tomorrow. Probably he might die tonight also. And then we made several, frantic calls to make sure that he gets the right amount of medications and for the fermentation to improve his heart chakra, to strengthen heart chakra. Later on, we have learned that actually student was alone as part of the quarantine. He was put alone, and in that cell, in that room, he was so panicky. The next day, they knew that it was their fault, so he was transferred to other wards where there are several other students also. And on second day, third day, there was absolutely no problem. So there was, as Dr. Thiru says, loneliness, and also those kind of hopelessness. So therefore, I think these things need to be dealt with the more a positive kind of approach, and accordingly, we should. I think most of our students, especially now, and young Tibetan doctors, at least my suggestion is that we should also try to see the kind of the heart chakra is one of the very important factor, very important. Heart chakra, how to strengthen the heart chakra to strengthen your immunological parameters. And this is not only through the medication, but via, with counseling, I think in some cases, counseling, giving advice, giving more assurance, giving more kind of encouragement to the patients works much, much better than giving medicines also. So therefore, these things should go together, the counseling and the medications. Therefore, in counseling, more important thing is to build up the, our people's kind of, inner strength, the determination, the positiveness. Yes, they are looking at the more, what we say, looking at the more brighter side of the life, not looking at the negative side of the life, through the meditation, through the visualization technique, and through, relaxing your mind through various chantings. Those chantings, spiritual chantings, spiritual mantras can give an immense kind of, some kind of mental strength, spiritual aura. And it really helps to build up that. With that, our whole kind of, outlook, approach towards the pandemic may be also maybe, more I think, more positive. So, And of course, as Dr. Thiru says, maybe simple exercises, asanas, pranayama, and being really very kind of positive and encouraged all the time, of course, definitely helps. I think I'm running out of time, so I will stop here. Thank you so much.
Thank you, Dr. Doji Raptinla. You didn't run out of time. Thank you so much. And also, I would like to thank you for sharing so Rikpa perspective on this current pandemic, along with the case study. Thank you very much. And being a junior doctor, I would also like thank you very much. Thank you for sharing your menga, the secret instruction of counseling and medication, the significance of. Thank you so much. So our next speaker is Dr. Nagendra Babu, and Tenzin Kandala will give a brief introduction.
Today's last speaker, Professor Dr. G. Nagendra Babu, pursued his Bachelor of Homeopathic Medicine and Surgery degree in 1995 from Karnataka University, MD from Maharashtra University of Health Sciences, Nashik. He is currently the HOD of Maitreya Medica at Shri Sai Ram Homeopathic Medical College and has more than 20 years of teaching and clinical experience in homeopathy medicine. Dr. Nagendra Babuji is the author of a book titled Comprehensive Study of Organon, which is one of the favorite books of all the homeopathic students worldwide. He was awarded the Best Doctor Award for exemplary contribution in the field of homeopathy in the year of 2012. He has also presented various national and international papers on homeopathy. Thank you. I would like to request Dr. Nagendra Babuji to kindly start your presentation, sir, please.
First of all, I thank His Holiness, and I thank Men-Tsee-Khang, the department, if I am pronouncing properly, for inviting over here and giving me an opportunity to share my views on homeopathic perspective of mental health and pandemic. Sorikpa is not my new platform. I had exposure to your medicine when I met Dr. Tenzin, Dr. Tirunarayan sir in our National Store Siddha, Chennai. We are well aware of each and every one. And thank you very much for inviting here. And I am the fourth speaker. It was indeed a good experience. I could see balanced auxiliary methods, as other systems of medicine call us. Dr. Sering Choran has presented a philosophical approach of COVID presentation. And Dr. Tirunarayan sir, as his style, a research methodology he has presented in his perspective. Dr. Dorsey Rapton, he has presented an emotional approach to mental health and pandemic management. I am a general practitioner. Of course, I am a teacher in Sai Ram Homeopathic Medical College. And my journey in treating COVID pandemic cases started as early as March 2020, if I recall properly. It was a panic period. I suggest the problem in handling COVID was for every auxiliary methods, it's more of the panic that is created in the media, as other speakers and all of you agree. It was more panic. Because when it comes to viral management, the disease of virus, I think Ayurveda, Siddha, Homeopathy, Unani, and auxiliary methods can handle it very properly. Example is the handling of hepatitis B. Though the dominant medical school doesn't handle it properly, or I say they don't have a successful treatment, we auxiliary methods, or Ayush as we call, we could able to handle it very nicely and thoroughly. When it comes to handling COVID, as I said initially, and most of the speakers agree, COVID handling comes with handling of both mind and body, which makes it more holistic in approach, because the panic was associated. I call it as a panic rather than fear or something like created. The panic is created all around. When it comes to handling homeopathic approach of pandemic cases, COVID-19, I would classically divide them, being a teacher, to make me communicable, homeopathy communicable to other fraternity. I divide them into 3 levels. One is the clinical presentation of the case COVID pandemic. The American Lung Association in the initial stages has divided the COVID pandemic into 4 stages. The first 2 stages are not so severe. 3rd and 4th stages are severe and critical. As far as OPD setup is concerned, outpatient department, we are allowed to treat, or we can handle it in the first 2 stages. Whereas the 3rd and 4th stages, we require a IP setup or inpatient department where critical care ICU setup is required. So it comes under our parameter in handling COVID-19, though in the initial stages, the government of India did not allow us to handle the cases. But today the scenario has changed. That is one perspective. In classical, medical, clinical level, we have divided them into 4 stages. In all stages of COVID, we have seen panic. I'll try to present a few cases from my practice also. Second perspective is classical homeopathic parlance. The COVID handling can be divided into so many segments, whereas homeopathy treats COVID-19 in acute stage, because in acute stages, the pathology is so severe, the death of the patient can happen. So it's very severe condition. Second one is it falls under mental disorders. When it comes to homeopathy, given today's topic is mental health and pandemic, of course, this pandemic has really affected the mental health of the world, the entire world, I can say. So it's a pandemic. So mental stages or mental diseases in homeopathy, we divide them into 4 stages. Somatopsychic, psychosomatic, acute origin, and doubtful origin. So I won't go to that level. Somatopsychic is when a patient is affected with a physical disorder, and if the physical disorder is incurable, obviously the patient loses his hope and he ends up in psychological disturbance. So somatopsychic. From the somatic sphere, it transferred to the psychic sphere. So I feel COVID falls under somatopsychic and acute origin. Acute origin of mental condition, until unless you find out a solution or you find out a treatment or his reports become normal, the patient cannot be recovered from his mental condition. Now, handling COVID cases in 3 levels we can divide in homeopathy. One is the prevention, which is very important when it comes to medical perspective. Second one is curative. The patient is affected, then what to do? The patient wants cure. Okay, we have to cure them with certain medicines which are available. For practical purposes, I have taken remedies accepted by WHO and Ministry of Health India. I will try to present few cases also here. And third one is post-COVID complications. So handling of COVID can be divided into 3 segments or stages: preventive stage, curative stage, and post-COVID complication handling. When it comes to preventive in India, as far as India is concerned, the WHO and the Ministry of Health has recommended a medicine called Arsenicum album 30 potency. The 30 is the potency. The posology here is the patient will take a single dose every day morning consecutively for 3 days, and this can be repeated every 15 days or monthly once based on the physician's decision. I repeat it: arsenic alba 30 potency. The patient takes single dose consecutively for 3 days, and 15 days once or 30 days once the patient has to repeat it till the pandemic disappears from the map of the world. Now here, even as I said, every stage of the COVID-19, preventive stage or curative stage or post-COVID stage, when the patient recovers from active COVID illness, everywhere the mind has to play a major role. Mind is playing a major role. and a panic is there in the minds. If I recall properly, May 2020, I got a phone call. I was not seeing patients directly at that time. I used to fix phone consultations, and I used to send the medicines by courier, or the patient's kith and kin will come and collect the medicines from my clinic premises. Now this lady called me. She wanted to speak to me personally, and I spoke to her. And she said, "Doctor, I developed a throat cancer. For 15 days, last 15 days, I have been vomiting blood. Whenever I brush my teeth, whenever I try to gargle my throat, or whenever I try to shout, blood is coming out. I got cancer." I said, "Who told you it's cancer? It's only 15 days since you have been having it." She said, "I know, I want to consult." But anyway, by her force, I made a consultation, and she came in person. And after proper case taking, I came to know that out of fear, to prevent herself from getting COVID infection, government of Tamil Nadu was recommending Siddha medicine, Kabasura Kudiniru. Tirunarayanan sir, pardon me. And she took this 4 times per day, a full glass of it, daily for 15 days. And I think it was not the dose recommended. And she did this out of fear. She said, even if I develop mouth ulcers or ulcer, doesn't matter, I should not get COVID. Okay. And she believed in Kabasura Kudini, no doubt, but the dosage was very bad. And I had to counsel her. Dr. Dorji was telling, all we need is counseling and getting the faith of the patient. That is important, especially in COVID. Education, like our Abdul Kalam sir says, education is the only tool India requires right now. Okay, Indians are well qualified, hardworking, everything is there with Indians. What we need today is a proper education, a logical application of this education. So as I said, after good counseling and proper counseling and giving the proper dosage of Kabasura Kudinir, I added my medicine arsenic alba. I converted her. Sorry, Tirunarayanan sir. So I prescribed arsenic alba 30 and she is good now. And proper counseling and mask maintenance and distance, social distancing, everything were explained to her. So this is the thing I can say. In the preventive level also, we can have panic and fear which has been created. Most of the cases which I had in COVID cases, in my clinic, I have seen around 25 to 30 cases of COVID cases so far. Of course, by phone consultation I did. And I treated successfully with homeopathic medicines. Of course, some cases were also given for temperature control, crocin, which I accept. Hypoxia, dyspnea, anosmia, fever, pain. These are the commonest things which happened. And the breathlessness or dyspnea was the main important symptom which the patient had. The medicines that generally I prescribed in homeopathy, people who are interested, just for sharing with the platform. Aconitum Nepalis, the remedy is very good for fear. Fear of death, fear of sickness, fear of falling sick, fear of getting infected with the microbes. Everything you will find under this remedy. So to conquer the fear, we have prescribed Aconitum Nepalis and Arsenicum album, restlessness, a remedy for restlessness. The patient is so restless and he is also having fear of getting infected with somebody else. Okay, that fear of infection can be conquered with arsenic alba. Bryonia alba, Rastoxicodendron, Eupatorium perforatum, a good fever remedy and joint pains remedy. Ipecac cunha, Belladonna, and Gelsemium semipervorans. The drowsiness, the Gelsemium produces drowsiness. Gelsemium semipervorans is treated it was prescribed to a patient with cytokine release syndrome because it acts on the central nervous system. Of course, patient was under allopathy medication. Along with that, these cases were given these remedies. And in severe critical cases, phosphorus, chelidonium, veratrum viridae, iodum, camphora, China officinalis, lycopodium, arsenicum iodum, antimonium tartaricum, stannum metallicum, carbovage, and you people know another remedy, Justitia athathoda, and another remedy, aspidosperma. Justitia adatoda is a remedy. Israel homeopathic doctors recommended Justitia adatoda in a little diluted form, not in a concentrated form. The remedy has to be, the decoction has to be mixed in water, and the patient has to consume it. Justitia adatoda was recommended by Israel homeopaths, with later in India we started using it. And where the fear of blood clots are there. You know, recently we have a vaccine phobia. Even that also I keep under mental stress and mental management of COVID. Even people started fearing to get vaccine. I hope most of you doctors would have come across this. Even I had to release so many videos in my YouTube channel to educate my people, my patients. 5 minutes video, I released it. Vaccine phobia was there. Everyone used to come. Doctor, I am having acidity. Can I take vaccine? People are telling vaccine has a lot of side effects. Okay, it creates intravascular blood clots and everything. Those people who have, I had to counsel them, and I had to prescribe some remedies which can prevent blood clots in homeopathy. Okay, and another thing people fear is some patients are taking treatment from me for diabetes and sugar purely with homeopathy. And now when they go for vaccination, they were fearing that drug interactions may happen, because all these days they have been under homeopathic medication, and suddenly they have to shift to allopathy or vaccination. The fear of getting side effects or drug interactions was raised. And these are the things which I had to come across. So when it comes to mental fear, and several grades I can see. First thing is preventive, as I said. Second one is vaccine phobia. A third one is, of course, the picture of the disease infection itself is very fearful, because a lot of deaths were happening. According to WHO, neuropsychopathic symptoms developed in patients who had infected with COVID-19, or even people recovering from COVID active infection. They developed a neuropsychopathic infection within 90 days. So it shows even after recovering also the patient needs your help. We healthcare professionals, I feel, because we spend a lot of time with the patients, our case taking requires that. So we have to tap ourselves that we are doing all these things. The patient needs you. The patient needs your counseling. The patient needs your support. Anxiety, confusion, lack of knowledge about the spread of the virus, memory retardation, poor concentration, fear of death, all these things are the major problems that I came across, which I treated with homeopathy with a good success. Most of them are my patients or relatives of my patients who got affected to COVID, with COVID. And most of the speakers have shared, and we doctors, we know, we have to keep informed. The patient has to be kept informed. Okay, he has to have a routine daily life. Okay, he has to maintain his daily activities. Yeah, another thing I noticed in my practice is during this lockdown period, most of the patients used to get up very late in the morning. They had a very long holidays mood, and they used to get up at 8:30, 9 o'clock or 9:30, and most of them had their breakfast very late. So because of this late breakfast, most of them developed gastritis, and the pain in the chest, mid-sternal region, even they used to fear that they had lung infections and all. By proper case taking, we can analyze that, and we can recover the patient.
Sorry to interrupt you. You have
Yes,
5
doctor.
minutes now.
Yes, doctor, I'm finishing. Right, so most levels will have to help the patient. Another thing I'll say is another important mental problem that most of the patients developed recently is those who got affected, who didn't get affected, is unemployment. And second one is financial stress, loss of job. All these things have contributed a major problem in familial level and social level also. okay, which we can only counsel, we can only help them, we can only guide them. Okay, so most of these things, social factors, I can say. So individual level, familial level, and social level, the panic was created, and this pandemic has affected the social life also. Like WHO definition of health says, complete mental, social, psychological, economical well-being is called health. So just treating the COVID case physically doesn't help us. Okay, we have to treat and maintain the balance. So holistic system does it. And last but not the least, we social workers, we were also under pressure. We were also in panic. When I started seeing the patients I never closed my clinic throughout the pandemic. Okay, I was seeing patients either by phone or some people used to come over here. Even my family members used to force me, don't go there, don't go to clinic, don't visit them physically. So these type of panic and pressure was also there from our side. And you can imagine the frontline workers who are facing the COVID patients would have had so many problems. The social stigma attached. In Bombay, one of the doctor was forced to vacate the house because he was working in COVID hospital. So these type of pressures were there. So the pandemic is still on. The waves are not over. So the fight is still on. So we'll have to be strong enough to maintain and recover the health of the patient in social, psychological, and physical, economical level. I have shared my PPT to get the medicines and all with the organizers. The organizers can share it. I am free to them. And finally, I end up with Buddha's quoting. You can't always cure, but you can always care. And that is what the hospitalization is. Hospitality is the major thing, and the Ayush departments will does it with grace. Thank you very much.
Thank you, Dr. Nagendra ji. And thank you for ending your presentation very beautifully with this line from Buddha. So I would like to thank you for sharing your experience through this very informative and enlightening presentation. And I don't know what Dr. Thiru has to say on your presentation.
Yes,
Okay,
please, I would like to listen.
Yes. So
Okay.
next, next.
I have a minute.
No, Dr. Thiru, give me a minute. So
Okay,
next
okay.
we are opening. Next,
Okay.
we are opening this.
Sir, you're my senior. Please, I would
Yeah,
like to listen.
we are opening this for question and answer session. So I was, thinking of asking Dr. Thiru Narayan ji about your take on Dr. Nagendra Babu's case regarding the Siddha medicine.
Okay. In the first place, I completely agree with Dr. Nagendra Babu because I never encouraged that particular medicine called Kabajara Kodini.
Oh.
In fact, I was excommunicated from the Siddha community for speaking against that.
Oh.
Let me explain. There are 15 ingredients in that. Of that, 4 are from Himalayas, and you don't get that quantity anywhere in the world. Like Anacyclus pyrethrum, Sarsuria lapa, we have been distributing, selling it left, right, and center, and I have highlighted to the government many times because unethical. And some other herbs we had were not even grown because it were only pot herbs, which are never grown for such a large quantity. Imagine around 1,000 metric tons of these kashayam are being sold. 1,000 metric tons, the volume. So I have never encouraged that, and that was not scientifically evident. Even the first, the college, Siddha Medical College, the oldest college, which is 57 years old, never dispensed this medicine for 56 years before the pandemic. It came in the mind of few commercially interested lobby who promoted this Kabajara Kudineer without knowing the ingredients. And there was a howler, a mistake, even in the government orders, that somebody suggested it for 1 month. What Kudineer that we gave was Nilavembu Kudineer with Eschichuranam. Andrographis paniculata, Boonimba with Eschichuranam, and we gave it only for 3 days a month, twice a day, 3 days a month. So I fully agree with you. Any abuse or misuse of a substandard quality medicine, of a wrong dose, of a wrong quality, will definitely affect the well-being of the patient. And there are many adverse drug reactions reported for Kabajirapunni. So I fully agree. It was not prepared as per the standards.
Thank you for saving me from Dr. Tenzing.
There is a question for both Siddha and homeopathy doctors. So this is from Tenzin Choktup. I don't know if this is Dr. Tenzin Choktup or the one. So it says, according to Siddha and homeopathy medical system, which you mainly focus to boost immunity physically? Seems on what do you focus mainly to boost immunity physically? So who will go first?
Seniors first.
Okay. Okay. See, let me make it very clear. A specific virus and its antibodies can come only by the infection or by the vaccine. So you don't call it as the immunity. In this case, the immune system was overacting. That is why you had the cytokine storm, you had all this kind of clots and other things, and destruction of the lung. So therefore, I might accept that the immunity was the cause. To have an ability to fight disease, three things are very important. I will first use the Sanskrit term and then come to English. Adhara, Vigara, and Nitra, meaning good food, good physical activity and exercise, including yoga and pranayama, and then good sleep. A good 6 hour or 7 hour sleep is this will not, immunity will not come overnight. For this to come, you have to be practicing this. You know well, I don't take calls after 9 o'clock in the night, but I'm active at 4 in the morning. So the good sleep of 6 hours of sleep, good food, balanced food. Balanced food, when we say balanced food, it contains all the 6 states. For us, the balance of food is the 6 states. The sattvic, rajasic, tamasic food in the proportion of the food pyramid. And good yoga, pranayama exercises. This is what will build immunity. But the question is about specific physical immunity. I would say these 3 things, not just for the body, but also for the mind. Thank you.
Yeah. As far as homeopathic perspective is concerned, like our senior sir was telling, doctor was telling, immunity cannot be built, especially individual immunity cannot be built in a day. It has to start from right from the beginning, like Ahara Vihara I was telling. The same concept goes in homeopathy. We call it as a constitutional therapy.
Yes.
Physic, mind, and soul. These 3 has to be strengthened. Okay. So the immunity starts right from the beginning. First point. But when it comes to problem, okay, that is what allopathy criticizes us. The homeopathy has an answer for that. As I said, the COVID has to be handled in 3 levels: preventive, curative, as well as post-COVID. In preventive, arsenic alpha I strongly support, as recommended by Central Council of Research in Homeopathy, a body, governing body. Because during my presentation just now, I said the panic can be removed by arsenic alpha, because arsenic alpha produces panic. That is homeopathy. If it produces, it cures. So arsenic alpha has a capacity to reduce the panic, as well as arsenic alpha has a capacity to remove the phlegm, the kapam, and everything from the body. So it is a supportive remedy when it comes to prevention as well as curative level. When it comes to just discussion point of view, microbiology we have been reading. Vaccines, yeah, you cannot deny them. Vaccines have a good role. It is backed by a lot of research work. But as a doctor, we are supported with our logic. A diagnosis is a result of logic, not by knowledge. Okay. So when you inject a vaccine to a patient who is not, dietarily stronger or protein energy malnutrition. See, when you inject a vaccine to a person, the antibodies has to develop, and it is nothing but immunoglobulin. And the globulin element is nothing but protein. If protein sufficiency is not there in the body, the patient obviously cannot develop the potent antibodies to fight against the antigen, right? So it is the doctor's decision. That is why physician's decision is final. So everywhere we cannot apply it. And to my students, every time I'll say, in my book also I've written, the allopathy medication is ready-made. Whereas auxiliary methods, you call it as Ayush systems, it is a tailor-made. Like a tailor stitches the clothes to each and every person's necessity, we have to select every stage according to the patient's requirement. That is why the case taking is very crucial in our medicine. I hope I have answered it.
I would like to ask if Dr. Dojir Abdullah would like to add something from the SWORD perspective, and also Chief Astroscience Practitioner Srin Chanzumla.
Oh, I think, yes, immunity built up. As I think Dr. Nagendra Babu, very correctly said, it cannot be done instantly. And it has to be naturally. It has to be slowly built up. So all this probably, takes time. And what is most important thing, as I think also, Dr. Chiru said, those things are very important, because, good kind of food, proper lifestyle, they are very important thing. And you have a good food almost with all the essential components of minerals and vitamins and nutritions and all this, plus the lifestyle factor, which are always very supportive, very positive, and very affirmative. Naturally, there is a good kind of the what do you call it, a kind of immunological strength. But I think through the story, but I think it's also very important for maybe all of us to know that one of the most important factor for building up the kind of the immune system, defense system, is the heart chakra. Heart chakra. As we know that when we are run down with emotion, the fear, the hopelessness, we see the people down. Morally, even our back also, even our whole thing becomes down. So nothing moves inside. There's no physical blockade. What we call, there is an energetical blockade. There is an energetical blockage. With that blockage of the chi, the proper energy flow, the life force energy, we are blocking all the kind of essential, what do we call it, a fuel that builds up our body's cells, tissues, muscles. So therefore, primary importance should be given in strengthening the heart chakra. So therefore, the strengthening the heart chakra also depends on how we as a doctor, probably supports the confidence in the patients. That's very, very important. And in Tibetan medicine, we have what we call as a Lusung Dun. Lusung Dun is a 5 essential body constituents. That is bodily essence. After we ingest the food, bodily essence, and then the blood, then the muscles, then the fats, and then the bone marrow, and finally this what we call as the final product is the what do you call it, the something like it can be all semen, or something which we call it radiance, something with ultimate kind of the essence of the energy, that is regenerative. You can also call it the regenerative fluid, which gives life. So therefore, if your lifestyles are good, then the bodily essence, whatever you eat, if they are in a proper kind of balance and the proper kind of nutrition and proper kind of proportions, then of course, okay, your body essence is good. When the essence is good, the blood then comes with the muscles, then the bones, the bone marrow, and everything. So therefore, these, especially I think the strengthening of the heart chakra, thereby strengthening the flow of the chi, the energy, the life force energy to the body system, is utmost important to have a very, very, quality, what I would say qualified kind of, the immunological, the build-up in the body system.
I have not much to add here, but in Tibetan astroscience, it is always believed that, right time for doing right thing is very important. So we should be very cautious and careful of the time we have. So we should be making right use of the time and take proper care of, what is required at that particular time.
Thank you, our speakers. So I would like to now open this platform for our doctors. So kindly pose in your questions if you have.
Namaskara, sir. Sir, my question is, in your presentation, I have seen that you do or you suggest sun therapy for the COVID patient.
Yes.
Yes, so my question is, do you suggest sun therapy for the COVID patient with high fever?
No, not for them. You are right. It's not for them. What happens is not for the COVID patient. What happens is many people have been lying indoor. They have been staying indoor. They have frightened osteoarthritis patient and various other patients. They are confined to the room. Yes, during infection, the 14 days, they have to be completely inside the room, and most of them kept their doors and windows closed so that it doesn't spread to others.
Okay.
Right. Post-COVID, they have to have some kind of an exposure. The oxygen capacity, the lung capacity has to improve. For that, whatever they have lost during the 14 days of quarantine inside our room, we want them to be exposed to sunlight and open air. You're right. And generally, people were staying indoors, especially the elder were forced to, elders 60 plus, 70 plus, were forced to stay indoors by the family. So that led to depression, loneliness, right? So those kind of things to be avoided. One best treatment for depression is sunlight.
Okay. Thank you.
Thank you.
And one more question, sir.
Yes.
I didn't understand kashayamas. What is mean by kashayam?
Okay. Kashayam is a decoction, a herbal tea. The simple form is a herbal tea. There are two kashayams which are very useful in this duration, according to me as an individual, like Nilavembu Kashayam. This contains 9 ingredients: Bonimba, Vetiver, Patola, Chandan, and various ingredients like black pepper, long pepper, and all those things. So this decoction usually is available in the form of a kwada powder, churran, decoction powder. So what we do is 2 grams of this Nilavembu Kashayam and 1 gram of Eshti churran, Adi Maduram, in Tamil, Eshti churran, licorice in English. So we make a blend of it, boil it like tea, and twice a day for 3 days a month for prevention. If somebody gets the disease with fever and other symptoms for cold, cough, we give this twice a day for 5 days. Twice a day for 5 days. And if they have cold, cough, and other things, we give Ada Doda. That's what Dr. Babu was also saying, Justicia Ada Doda. So that is the decoction, herbal tea. 2 kinds of herbal tea were very useful. One is Atraphis paniculata with licorice, other is Justicia Ada Doda with long pepper, etc. It's a tea, herbal tea, let's put it simply. Yeah.
Thank you, sir.
Yeah, if time permits, I would like to add one more in sunlight as organizers.
Sure, I was about to request Dr. Nagendra and Dr. Dujir Abdullah to kindly add few points from the respective the perspectives.
Yeah. So when it comes to sunlight, like general, everyone knows that sunlight is having antifungal properties. So one of the complication of COVID-19 is mucormycosis, the fungal infection. It's being true. And one of the surgeon was criticizing in one of the video I've seen in social media. He's a surgeon from Bangalore. He's hailing from Bangalore. And he said that mucormycosis in India is rise because people started having steam inhalation frequently. Though I don't support it, I criticize it. Steam inhalation is one of the treatment for any respiratory infection we do, but it has to be done under a process. And I'm not that much informed in this subject, but when it comes to yoga, Nasika Shuddhi is there, where the salted water is poured from one nostril and removed from another nostril for Suddhikarana, the cleansing process. But after the cleansing, the patient has to sneeze it out. The Chitkari pranayama something methods, he has to drain the water out. So only when you do the process perfectly and completely, it cleanses your tissues, right? I hope. So sunlight has, as Dr. Doctor was telling, Narayan sir, sunlight gives exposure, it gives vitamin D, and it is good for fungus infection also, and it dries the tissues. Sir, I'll say one thing here. In homeopathy, we have different sources of medicines. We have medicines from plant, we have medicines from chemicals, we have medicines from animals also. There is one more source called as imponderabilia, where natural powers also used as medicines. Sunlight, moonlight, the magnets, the north magnet pole and south magnet pole, all these things can be used as a medicine in homeopathy. There is one more section.
That's very good. Actually, I would like to take this opportunity to show you Dr. Thiru and Dr. Nagendra Babu, our Kashayam.
Yes.
Our Kashayam, we call it Thang. Thang is actually a Kashayam, you know. So this is called Thul Thang. Thul Thang, I actually used to explain to my patient, this Thul is something like a magic. And Thang is a decoction. So this is indeed a magic decoction when it comes to the preventive measures. You know, this is being even in Bangalore in our clinic widely used by our local patients, and some of the patients, they really swear by its name. And the family should have it as their property, the family property. So whenever some family have some cold, some cough, throat irritation, fever, feverish feeling, all sorts of these, you know, small opportunity, common kind of, you know, this really works. And I think even in the COVID, particularly in terms of its kind of, you know, preventive measures, and many of our patients have reported a very positive feedback that most of I think our entire family was actually surviving on Thultang. You know, they have that fear of going into the hospital. You know, again, hospitalization, then expenses, then so many things that follows. You know, so they were somehow trying to make sure that they need something which they can stick to. So this Kashayam, and it's actually also made of the, you know, base is the, what do you call it, 3 myelobilin fruits. Myelobilin fruit, that is Terminal Chibula, Terminal Bellerica, and also the, what do you call it, the Ambelica officinalis, that in Ayurveda, what do you call it? Amla.
Triphala.
Yeah, and then you, and Google, sorry, the Google is also there. Plus the Guduchi, you know, you call it
Giloid.
Yeah?
Giloid, Tenosperma cordifolia.
Tenosperma cordifolia, yes, Guduchi, you know. And then also the what do you call it? More of a wild kind of ginger. It's called wild ginger, not that ginger we cultivate. It's from we used to collect from the, you know, higher altitude kind of that ginger. And I think plus few other things which I will not reveal, but this really works and it's fantastic. And I think I would probably, I mean, if something works out good, something works out in more, proper atmosphere, probably it could be one of the, as many of my patients were telling that it could be promoted as one of the preventive measures, in the Ayush kind of, in the Ayush way of, at least, the promoting the indigenous systems of medicines in the. This may be very helpful. Sunlight, of course, as we say, our body system itself is made of two basic energetical dispositions, like our universe. Our universe is composed of, either the solar energy or the lunar energy, both. And they work actually in kind of kind of what do you call it, in unison with each other, and building up that kind of the balance, the dynamic balance of the energetical systems. So therefore, every time nowadays with the modern day lifestyle, we hardly have any sunlight. We are always indoors. So therefore, sunlight may be very helpful, especially in the morning hours, morning sunlight. The morning sunlight, I think, though we have not done any proper research, I would say the morning sunlight will be the real essence of the cosmic kind of energy. Real essence of the cosmic energy. So the sun that has fallen to the earth, but not really very, very hot, not that, very faint also, but maybe, so therefore, during that kind of time, we need to absorb the sunlight through the breathing exercises. Sometimes we say we need to open up all our senses, the five, our consciousness, eye, ear, all everything, including our mouth, to the sun, to make sure that we have enough of that energy, the solar energy inside ourselves. So therefore, I think I really, always, I'm a good kind of, what do you call it, a big fan of sunlight. So always try to have at least some kind of, exposure to the sun. So I really recommend sunlight.
Thank you, Dr. Durapla. That's what we can see, that you are so energetic, just like the rising sun. So there's a question from Dr. This is not Dr. Tenzin Chodup, but someone called Tenzin Chogdup. So the question is there same like pandemic documented in Siddha medical history?
Yes, yes. At different points, in fact, every year too, we are not talking about what called the Spain flu. We are not talking about 1930s. We are talking about things that are happening recently. Even the last 10 to 12 years, every year we have been having dengue, swine flu, avian flu, various flus, viral diseases which were targeting our country, particularly the states of Kerala and Tamil Nadu. So every year, in fact, some of our publications are already there in the internet now from reputed journals, Siddha interventions during the pandemics and other epidemics. We have documentations, yes.
Thank you. So the last question is from Dr. Tempa Kinzom. And the question is for all our doctors, the speakers. The question is, which food and fruits did you suggest to your COVID positive patients? So again, maybe senior ones.
More senior one.
Yes.
Then it's you, Dr. Dodgy. Dr. Dodgy, it's you.
Dr. Dodgy is the youngest one.
He's the youngest. He's the youngest.
See, it's very important because the first day of fever, people don't want to eat anything. We force them to eat some idli, something like your rice string hoppers, rice noodles, so which is baked or mild, and what porridge with ajwain, porridge with cumin. All these porridges we suggest in the first day. Second day, once the fever comes down, once they become a little better, they start asking, can I take this soup, that meat, this fruit and all those things. We advise them to go slow, take fruits which are not very sour, fruits which are not very sour, fruits which are not very heavy. Maybe we start with pomegranate, dates, little of dry fruits, then specific varieties of bananas called as elaki. You being in Bangalore, you will be knowing elaki banana. They are small ones. So these kind of fruits we encourage them to take initially. So these are the fruits that we take. As far as food is concerned, see, generally people have been advocating they require a lot of protein, they require a lot of spices, give meat, the chicken soup and all those things. But very unfortunately, many of the patients love the taste, love the smell. So for them to take even the normal food was a problem. So give them the mild, bland foods, which will start taking. Once they get the energy, they will ask demand more.
Now it's my turn.
Yes, please go ahead.
Sir, as I've been suggesting, like 3 stages I'll divide: preventive, curative, and post-COVID. For preventive purposes, as I said, a regular staple food, since it's being a respiratory problem initially, of course it comes to multi-systematic later. So initially I'll ask and encourage all patients to brush their teeth morning and night without failure, and salt water gargling with a little amount of salt in a full glass of water, and that has to be maintained regularly. If the patient is affected, okay, with COVID, so bland diet, any bland diet, depending upon the area. As far as Chennai is concerned, as doctor was telling, boiled rice, idli, idayappam, the same kind of noodles kind of thing, boiled ones I recommend. I restrict everyone to stay away from fried items and sweets because it can be harmful to the throat and tough to digest. And soups can be encouraged, especially vegetable hot soups. Post-COVID, I recommend them to go for sprouts because a lot of tissue damage will be there. The patient has to go for sprouts, and I encourage them to go for papaya. These are the things I generally recommend.
I think there's, through the Tibetan medical texts, there was one line which clearly indicated of stating that one should avoid, especially, not COVID-19 per se, but any kind of infectious and contagious disorders of, epidemic like this. Karpo is like something white products, especially during the thick of the infections. If you start taking something like milk and paneer, cheese or curds, maybe or in white sugar, white sugar or any white kind of maybe a gluten, and probably better to avoid. And sweet, especially any kind of sweet, because many of the infections they have a tendency to thrive on sugar and sweets. Infection grows more in sugar and sweets. So any kind of sweet products, sweet kind of food items may be strictly avoided. And from the from the best kind of food, I would recommend samba. Dr. Thiru may have tested samba while in Bangalore, while in Dharamsala, I think. I don't know, I'm not very sure. The samba is a staple Tibetan food.
Yes.
Which actually it's like a roasted barley powder, and very energetic, very energetic, and I think it could be one of the best kind of food products, which you can definitely depend and believe in boosting up your immunological system also. I have one doctor, from Coimbatore, and when I started suggesting samba with him, whenever he visits our Tibetan settlement, which are not very far from his place, and whenever he visits Tibetan, first thing he goes is to look for samba. So champa is very healthy, though of course we need, the very naturally. As Dr. Nagendra Babu also rightly said that we need to follow up some, some kind of pattern, during the, when actually you are COVID positive, but when you are not symptomatic, then you may have a different food, because your pulse, with Tibetan doctors need to look at the pulse and urine analysis. When the pulse and characteristics do not show any kind of indication of severe kind of infection, you cannot, suggest any particular food to kind of which helps in bringing down that infection, which helps in fighting the infection. If your pulse analysis definitely shows indicative of high fever, then there are certain foods which may be very helpful, even in terms of the kind of relieving the headache, also bringing down your kind of body temperature. And of course, we can say, you go with some kind of the barley powder, as well as something ragi muddi, or millets, or certain kind of the even green leafy fibrous vegetables. Green leafy in South India, you what do you call it? This methi leaves, drumstick leaves are very famous. They may be very good when during the kind of pathological kind of stage, when the infection is pretty strong. But during post-COVID, when the infection has actually, there's no more infection, it's total remission, but that time, according to the Tibetan medicines, that we need to be very careful, because during that time, chances are that the body's, this lung, we call it lung, and in Ayurveda they call it, vata. That lung, which is also very responsible for, which also goes with our own breathing, and every aspects of body functions, whether it's neurological, blood, circulation, whatever, that without the help of lung, nothing moves. If it kind of comes up as part of the post-COVID kind of infection, we need to give something like some nutritious kind of food, some kind of very soothing, pacifying kind of soup, so that this lung doesn't aggravate. Very lung, once it gets aggravated, then it can turn the devil. It can cause a lot of other complications, where we sometimes can, in many occasions, the patient has really improved after the, even discharged from the hospital. Right after that, many complications. So therefore, and post-COVID, the care with right proportion of the food and nutritions, and especially fruits. Fruits also, you need to see its properties. Each fruit has a different properties, have a different taste. When it have a different taste, it has a different kind of potency and different kind of properties. And these properties has to be matched with the condition of your patient's body, especially patient's body constitution and the state of the health. Based on that, okay, let's give you one example. For instance, in a post kind of COVID, patient is still coughing, a lot of congestion in the chest, still coughing badly. If you continue to give banana and papaya and many, what do you call, flashy fruits, then your congestion becomes more. You have a more problem. You have more cold. On the contrary, probably during that stage, some other fruits which are more kind of, something like dates, some pomegranates, may be very helpful, pomegranates, and fruits which have a light property. Fruits which have a more light property will definitely help when you have a little more kind of cold and congestive kind of chest. So therefore, even the question was very pertinent, just because that each and everything needs to be done based on the pathological condition of the patients. I would say there's no magic bullet in everything. So as Dr. Narendra Babu also said, that our way of treatment is also tailoring kind of based. Therefore, and based on your body constitution, based on the pathological condition of the patient, based on the body constitution, his personality, all these diet, lifestyle, and even the foods and fruits should be based.
Thank you, speakers, for sharing your knowledge and rich experience with us today. Now, I would like to request our director to kindly give us the closing remarks on this webinar.
Oh, hello. I have nothing much to say other than all the speakers have made wonderful presentations and from different perspectives, and questions are also good. And I thank our mental health department for organizing another webinar. So thank you very much. We need to do more of such things in our mental health, because now these days we make a lot of tours abroad, and giving talks on different topics to different themes like that, whether it's on astroscience or whether it's on medicine. Western doctors, Western audience, they ask a lot of questions on our contributions on mental health, relationship between Buddhism and medicine, relationship with all the, and even His Holiness's discussions with the scientists are more on, this mental health and neuroscience like that. So, and we have a lot to contribute. Only thing now we need to show. So thank you very much, speakers.
Thank you, sir. So on behalf of my department, I would like to present a short thank you note. So as we have, doctors and participants from different parts of the world, so I would like to share with you all that Dr. Thiru Narayanan ji has been associated with us since the second Body, Mind and Life conference, which was held in 2014. So and we would like to thank Dr. Thiru Narayan for always showing his support to SOA Rigpa system of medicine. It was because of him that the 11th Body, Mind and Life conference was held at National Institute of Siddha Medicine, Chennai. And it was also because of him that we came to know a very good homeopathy doctor, speaker, Dr. Nagendra Babuji, who was introduced to us by Dr. Thiru. And he was also the speaker for 11th Body, Mind and Life conference. So it has always been a pleasure working with both of you, and we look forward to more collaborations with you in future as well. And next, I would like to thank our highly experienced seniors, Dr. Doji Raptenla and Chief Astroscience Practitioner Sring Chunzumla, for being an inspiration to many juniors like us. We always look up to you as our guiding force in our academic and clinical fields. Likewise, I'm thankful to all the participants for joining us. I'm sure the participants in this webinar today who are medical practitioners and students have benefited from all the 4 presentations here. And one thing more, that I had requested the SOA Rigpa College Nepal to join, International College to join the webinar, and I can see that many of them have registered. So I would like to thank Dr. Jimbala and team for joining this webinar. And then to conclude, I would like to say that under the blessings of His Holiness the Dalai Lama, our director has been our guiding force since the inception of the department in 2013. This department was known as the Body, Mind and Life Department and renamed as Mental Health in 2020. So it was only under his visionary guidance that we have been able to take many new initiatives, and with his support complete them with ease and dedication. Thank you, sir. And more importantly, since we are talking about mental health and pandemic, so during our stay at Dharamshala, it was only because of our director and his strict policy that we all remained very safe and sound, even in the time of lockdown and the pandemic. So I would like to thank our director from the core of our heart. And then lastly, I would like to thank my team at Mental Health, those who are here behind the stage helping me with all the technical issues, and our IT department at Dharamshala for making this event possible. And this special message is for Dr. Thiru and Dr. Nagendra ji. Unkalay Mintam Kannalam Enno Nampukirin, which means hope to see you again. And then Patu Kapaka Iru, which means stay safe. So bye bye and see you all very soon again.
Same to you. Same to you.